Thank you so much for having me, and hello to everybody at the watch party in Marquette right now. You probably can't see it, but it's a standing room here in the back, so we're happy that they're having a watch party for us, and thanks, Matt, for paying for the pizza. All right, so I'm going to start with a story. This is a true story about two sisters. They both had the same cancer gene risk, and one of those sisters, her insurance company paid for a preventative screen, and the other sister did not. The sister who passed away from this not getting a preventative screen because her insurance company denied it is sitting here. Her name is Kathy, and she's actually the mother to our front-end developer, Max, who's sitting right next to her. So for Max, this is really personal, and it's personal for me because I've been a nurse for 15 years. My job was the intersection between hospital administration and the doctors and nurses delivering the care. So I was in the care management space of nursing. So I saw all the insurance claims, okay? And I have a mission to give every claim a fair chance. Every day, providers like this, and I know there's some in the room here, so thank you, provide care to patients, and they make decisions in a split second, what's best for the patient. The problem is those decisions don't always translate nicely onto insurance claims forms, which oftentimes are still paper, if you can believe that or not. So what ends up happening is 15% of all insurance claims get denied, even if you have perfect front-end processes. And you might have seen that the news is starting to catch on to this, and everyone is demanding that we do something about this. Now, I've known this problem for years, but I never knew what to do about it until I had the idea to start Authsnap and figure out a way to automate this process. Here's how the process is done right now. If I can get this to advance. Okay. Well, first let's talk about what it looks like from a revenue perspective, because let's face it, there's a business case to this, and that's why we're here. So a typical mid-sized hospital will admit 17,000 patients a year. If 15% of those claims are denied, if you do the math on the claims, which roughly equals $4,000 a claim, that hospital is going to lose $10.5 million of revenue. Now, that might not seem like a big number, but most hospitals are operating on a 2% margin. So this number is very important to them. If you write an appeal letter to the insurance company, 70% of the time you can recapture that money, but it requires a letter to be written. So if you already have a nursing shortage, who is going to write these letters? Not the doctors, and you're not going to pull your nursing staff from the bedside to write the letters. This results in $262 billion worth of claims that don't get paid. And guess what happens when a claim doesn't get paid? It gets passed to the patient. It affects the community. It affects you and I, everyone in this room, and I can tell by the head nods that you have personally experienced this as well. So this is the current process. Believe it or not, most places are still doing this. You basically have a nurse take a bunch of piles of paper, sometimes printing them out and starring and underlining areas of the chart so the insurance company will actually listen to you. Then you write an appeal letter that factors in state laws, peer-reviewed journals, and the own payer criteria, and you submit that letter to the insurance company. Well, as you can imagine, that takes a lot of time. So what we built at Authsnap is a SaaS tool that can do all of that stuff automatically, and it can create the appeal letter within a few minutes versus a few hours. This frees up the clinicians to do work at the top of their license. Now, there are people that are coming up in this space, mainly because most hospitals and clinics, around 96% of them, have said that in the next year, they plan to use some form of AI for this problem. So what a lot of people are doing are spinning up LLM wrappers. There may be existing softwares that are out there, and so they're using a generic type LLM. But what we've done is built a custom closed LLM that factors in the payer nuances, the clinical guidelines, and writes a letter like I would write it as a clinician. Now, this is our founding team. I came alongside a doctor and a very strong business partner because you can imagine coming from a nurse, I had a steep learning curve in this space. So Dr. Wal Cooley has been a chief medical officer for several systems, and Scott Senden is a former vice president at United Health Group. He was in charge of IT projects, so he knows how to get software off the ground and was instrumental in helping us to get our software to where it is today. Now, we surrounded ourselves with advisors who not only had startup experience, but also had go-to-market strategy for enterprise healthcare sales because it's a very complex sales cycle. We also surrounded ourselves with a Department of Defense cybersecurity expert, which is a layer above healthcare. And Matthew Versace is currently advising the White House on their CMS initiatives for AI. Those advisors helped us to create a go-to-market traction that's working very, very well. We use referral partners of people who are already in healthcare sales. We use channel partnerships, and then we use our own subject matter expertise as clinicians in the sale. So we have a strong pipeline right now, and we have contracted about $200,000 of work over the next 12 months to execute. This is our revenue projections and our early clients. So Lucid Health and LiveWell MD are already signed paid contracts, and Centra Health and Honor Health are in the sales cycle right now. Centra Health is asking us to build them a product for an outpatient problem. So we'll talk about that if you have more questions about our go-to-market strategy. But because sales in healthcare takes a long time, outpatient methods go a lot quicker. These are usually physician-owned practices. They like revenue, they want revenue, so if you can solve their problems, they move a lot quicker than the hospital systems. Now, none of this would have been possible without our partners at Innovate Marquette in Michigan. I see some smiles in the room, so I see that some people know them. Because they helped us early on, we were able to get connected with investors and business support that we needed from a PR perspective. Pilots and just all that you see here was super helpful in helping us to really build a strong foundation as a startup. From there, we can take clients across the United States. We're currently finishing out our pre-seed round. We have $200,000 left in the round. You can see the terms that are there. And then we'll immediately turn around and start planning for our seed round. We're using the money for product development and customer acquisition. And you can see we have our investors who are up there right now, but we've also received quite a bit of non-dilutive funding in grants and partnerships with Microsoft because our product is natively built in Azure. I will take questions now.
Okay, well, first of all, congratulations on starting a business to begin with.
Thank you.
That's always, you've identified a problem, you're addressing it. However, there's others that are addressing this problem as well. I've heard similar pitches in the last 6 months. One thing that I'd like to understand, I went to your website and you offer both a service which is B2C, right, for me,
yes,
right?
Yep.
As well as the B2B, which is the hospitals, right?
Yes.
You're sort of betting on two horses.
Yeah.
Here, right? How do you see that evolve? We like to see focus, right? We
yes.
Like to see, here's my niche, right? The riches are in the niches, is what we say, right? Is this a gamble? This is an experiment? Are you actually intending to go to I want this to be a cell phone app for people, or are you actually thinking you can do both?
Well, that's a great question. And when Brian Thompson was murdered in New York City, the demand for consumers for our product went through the roof. So we spun up something over the weekend, literally 24 hours a day working to spin something up for consumers. It's in our back pocket if we decide to put market to that, but we know that that's not the best place for us. So we did have a couple of people who went through it, but as a team we sat down and decided that our best roadmap would be to build the product for outpatient clinics first, then hospital systems, and then a direct-to-consumer product. Along that way, there was a couple LLM wrappers who came up that are free tooling that direct-to-consumers can use. We want to help those people too, but that is, like you said, a very different strategy, and we know we can make the most impact by sticking with B2B. So while it's there, it is not our focus from a sales or go-to-market strategy.
Right, because if you did that, right, and because to straddle both lines, you'd have to say, we're doing this for hospitals so we know what works, right?
Mm-hmm.
Just like SEO companies keep on saying, we know how Google evolves their algorithm, that's why you can't DIY this.
Yes.
Right? Because DIYing this, from my perspective, is also an option, right?
Mm-hmm.
I can get good template letters. Anyway,
yeah.
So that would be the thing about, sorry, I know you won't.
No, I was curious, how do you make money? What's your business
Yeah,
model?
so that's a great question, yeah. So our current customers, because they're outpatient, we do charge a fee for the denied claims of $200, plus we take 10% of what we recoup. However, our hospital partners, it's an easier sell if you just do a recoupment. So we did a 25% recoupment for our bids with them, and they didn't bat an eye. Honestly, I was like, maybe I should have done 30. So that was not the problem, was selling. Healthcare sales has other challenges with the stakeholders that have to sign off on it.
Yeah, I said more because any dollar you bring back to them
Yes.
is a dollar more than they would otherwise
Yes.
have. So if you say I'm going to take half of it, they're still getting half that they wouldn't otherwise have.
Yes, yeah. So, okay, 50% it is. You all have helped me decide. But like, for example, a hospital will have a threshold as to what they just throw in the trash or write off. Actually, most of the time they sell it for 10 cents on the dollar to debt collectors, but that's a different story for a different day. So they'll make a dollar amount. We have found that dollar amount is somewhere between $3,000 and $4,000. So any claim below $3,000 or $4,000, they don't pursue it. But if you think about how many billions of claims fall into that category, that's where we really see the opportunity at first, because some of our competitors are really focusing on those bigger claims. So we can capture that whole low-hanging fruit market to start, and then build our sales pipeline to compete with those competitors.
What's the perspective of the insurance companies that, given that you're bringing them hopefully a well-articulated letter to make the case? I mean, are you getting pushback from?
Well, so there's 7 levels of an appeal, and the last level goes in front of a judge. So an insurance company is never going to push back on it if they know they're going to lose in front of a judge. That's really bad PR for them. It's also not effective for them, because then they waste a lot of resources to ultimately lose the claim anyways. So we found that the first level is enough to get most of these claims recouped, but you can go to like a second level where a physician advisor has to get involved, and then you have like a peer-to-peer between 2 doctors. So we can provide that service also when needed.
How long is your typical sales cycle with the hospital?
Yeah, so with the hospitals, well, it depends on how we collect the lead. The referral partners have established and really tight relationships with these CEOs. So one of them was about 8 months. Some of them are 15 months. Our outpatient providers, we had one decide in 2 weeks.
So you talked about how many denied claims there were in your average size rural hospital. How many are there in the United States in a given year?
Yeah, so there's about 480 quantifiable denied claims, but $262 billion worth of denied claims.
480.
I'm sorry, million.
Yeah.
480 million.
And sorry, the dollars again?
262 billion.
Yeah.
That's
Okay.
the dollar amount.
Yeah.
Like, I'm so excited that you're excited about this.
That's a
I
good
would lead with
place to-
that
Yes.
every time.
Yeah, so thank you.
Thanks,
Thank you so
Gretchen.
much.